Good evening, folks. Glad you're here for WVLT News at 10. I'm Ted Hall. Big news, of course, COVID vaccines now available to kids 6 months old and up. But there's some Tennessee lawmakers saying not so fast on the state telling parents to have their kids roll up their sleeves. Will Puckett's joining us. In fact, Will, one East Tennessee state rep kind of taking extra steps, saying the state health department shouldn't play a role in a vaccine that he claims is unproven.
Yeah, Ted, Representative Jason Zachary of Farragut wrote a letter to Governor Lee today that he said he has the full leadership of the House as well. After receiving emergency use authorization from the FDA, Zachary is now working to keep the state health department from administering and promoting these vaccines geared toward kids. Now, this request from Zachary comes from his reading of an FDA briefing that he feels leaves more questions than answers. What we do know is that briefing says that 24% of ICU patients during the Omicron surge were children. That's nearly a quarter of those patients. Zachary says that the state health department supporting full use of this vaccine, he says, is unnecessary given that many significant infections skirt kids.
There's too much unanswered within that report for us as a state to be able to say, yes, let's move forward and we will distribute, promote, and recommend putting this in 6 months to 4-year-olds who are right now not, unless you are significantly immune compromised, right now not at risk of COVID, hospitalization, or death.
2 million children have been diagnosed with COVID over the entire pandemic. Zachary adds that his request would only restrict the state health department from providing these shots, not all medical providers.
Mom, dad, aunt and uncle, and a guardian, you make that decision for your little baby after consulting with your doctor. And if you choose to get it, there are many resources to get it. We're simply saying from a state level, because there's so many unanswered questions, that we should not play a part in pushing that vaccine into these little babies and into these young children, these young Tennesseans.
Zachary added that he did talk to several doctors and pediatricians from Washington, D.C. back here to the volunteer state, and he says that he's heard pretty much mixed support for should those vaccines, if parents want to, should they be given to kids. Ted, it's important to note that healthcare providers who recommend these vaccines for children say that, among other things, these vaccines can help reduce post-COVID symptoms like what we've called long-haul COVID, which can plague children for years following infection too, and we still don't know the long-term effects of that long-haul COVID on kids.
All right, this letter sent to the governor. Do we know if Governor Lee has seen it or paid any attention to it yet?
Well, we reached out to Governor Lee's office. They said simply they have received that note. I did talk with Representative Zachary, what he's heard from the governor. He said Governor Lee was traveling, but in conversations with parts of his staff, he feels that letter was well received, Ted.
All right, Will Puckett, thank you.